Okay. Oh, I'm so happy to introduce my next speaker, my friend. You're going to love him if you haven't met him already. His talk is titled Understanding Epilepsy Cases in CTNNB1 Syndrome, Insights and Implications. Please welcome Shivang Khandelwal, researcher from the Hebrew University of Jerusalem.
Hello, hello. Yeah. So I thank you, Robert, for giving me this portable mic because I like to move while giving a talk. Thank you so much. And we had like amazing talks since the beginning. Wait, I'll grab this. And I would be talking about understanding epilepsy cases in CTNNB1 syndrome and what are the insights and implications that we can draw from them. So first of all, I would like to thank Effie and Spella because I started my career 3.5 years ago, met Effie and Spella, and they've trusted in me, connected me with the syndrome, added me to the foundation. And since then, we have been working together to understanding the disorder and also published a literature review. And yesterday you heard, Andrea, that the foundation together with the CMRI has a gene replacement therapy in making. So first of all, I also would like to thank some people like Daman because of like Daman and his team because they helped in collecting the data. Rodney Samako, he's not here, he's in Zoom. So thank you so much for helping us analyzing the data. And a little bit about me. So I'm doing my master's in Hebrew University of Jerusalem under Professor Rotham Karni in another developmental disorder. And soon I will be starting my graduate studies, higher studies in Prague under David Sabatini. And thanks to Roman Irala and Lezek for helping me because they were so helpful. So, James Garfield said, things don't turn up in this world until somebody turns them up. And for us, the somebody were Joris Weltman, Lezenka Wizards, and Dr. Joab Delight, whom we heard from yesterday. And these three, where is the, oh, and these three authors, how can I point it? Ah, got it. Thank you. So these three authors, they published an article in New England Journal of Medicine where they sequenced the whole genome of 100 individuals with severe intellectual disability. And they found these three novel mutations in CTNNB1 gene. This marked the beginning of CTNNB1 syndrome. Starting with 3 mutations in 2012, we have come a long way to having 430 patients. And this number is probably undervalued considering the cases which are considering the cases which are misdiagnosed with cerebral palsy and the cases which are yet to be diagnosed. From 3 patients in 2012, we now know that the mutations span across the whole genome. In the N-terminal domain, armadillo repeats, C-terminal domain, they are across the whole gene. Talking about symptoms, very important, but all of us know about it. Intellectual disabilities, speech impairments, facial dysmorphism, microencephaly, autism, cognitive impairments. This time, I would be throwing light on epilepsy because not much is known about it. Why? Because CTNNB1 is not an epilepsy gene. We don't care about epilepsy only in CTNNB1 as this gene has been reported to show epilepsy-related phenotype. It is a rare symptom. Not many patients are diagnosed with epilepsy. So doctors generally think that it's not important for the children to go through the screening for epilepsy. Rare symptom, so it will lead to a low prevalence. And finally, the signs are so subtle that to an untrained eye, they just look normal. You will never be able to find out whether your child is having a seizure or it's just a reflex. So I'm just going to show up a video. So that's what they say. It's just colic. It's probably just a reflux. It's a startle reflex. Your baby is just fine. It's nothing. But here you will see that these are infantile spasms. There is a sudden movement followed by a very surprised look on the face of the child. They don't know what's happening. Further, sometimes it can happen in an interval of 5 to 10 seconds, repetitively. As you will see shortly, here, this kid, his head nods. Who can say that it's an infantile spasms or it's something normal. They are unidentifiable, very hard to, because of the subtle signs. And CTNNB1 patients, they suffer from seizures during sleep. So it's very, very important to find out and to diagnose epileptic symptoms because they are diagnosed as colic, reflux, or just startle reflux. If you think they are having any of these, so there's a stop protocol which people have developed. You see the signs, try to identify it. It's very hard. Get educated. You are parents, you're amazing. Take a video, talk to the doctor, get the diagnosis. EEG is very important. That's the only way to diagnose and take medications. And prioritize the treatment because every seizure, every single day will increase the damage risk to the brain. It's very important. And I would like to thank you, Effie, because I'm presenting a patient perspective here. She shared some important details that I'm going to share with you. Effie said, and I quote, Ford exhibited behaviors which, to an untrained eye, were not alarming at all. They were just normal. He was showing severe startle response, which lasted for years, not only as a baby, and they were constant. And he would just laugh while staring at while just staring at the ceiling for hours. The thought of epilepsy never crossed my mind, as not many cases are linked to epilepsies. And as a new parent, I was unaware of the symptoms to look for. That's basically the case with all of us. We all are learning, we all are new. And so it's very important to get some help. Finally, only after a significant seizure, we decided to go for an EEG, thereby revealing a consistent seizure activity, especially during sleep. So you will never know that your child is facing seizure because they happen in sleep. More importantly, she said a very amazing line. I want to quote it. It's a reminder for the critical need for shared knowledge and support within the rare epilepsy community. Seizures. So I specialize in seizures and I study another developmental disorder related to seizures. So I'll just give what are the three major types of seizures which our patients, our kids suffer from. First is febrile seizures. It occurs in kids which are 6 months to 5 years old, and the body temperature of the child rises up to 38 degrees Celsius. For Americans in the crowd, it's 100.4 degrees Fahrenheit. And it's two types of a simple generalized seizure and complex. Simple generalized lasts for less than 15 minutes and they happen once in 24 hours. The complex one can last longer than 15 minutes and can be multiple times a day. Status epilepticus, this is a prolonged or repetitive seizure lasting for more than 5 minutes. And it is constant and doesn't give the break for the patient to recover and get to consciousness. It's just consistent. And infantile spasms, which I just told you about in the previous video. Being a molecular biologist, it's very important to understand what happens in the brain. So if we order to develop a treatment, we need to understand the basic mechanism. Due to lack of research and as seizure is not an important phenotype in CTNNB1 syndrome, there hasn't been much research related to this topic, but I'm going to give you a general understanding of what happens in the brain. Under normal condition, like human brain consists of many different types of neurons. Two of them are excitatory and inhibitory neurons. Whenever your brain fires, there's a firing by an excitation, and there has to be an inhibition to tell that you need to stop firing. In a normal condition, there is a perfect balance between excitation and inhibition. When such an important gene like CTNNB1 is mutated, it leads to disruption in critical pathways which are involved in neurodevelopment and other specific signaling pathways. Due to this disruption, these pathways, they lead to hyperexcitation and reduced inhibition. So imagine the situation when your neuron is continuously firing, but there is no supporting neuron telling it to stop. And so it will be leading to a seizure. And this is probably may contribute to seizures, but we need more research to identify the proteins, the pathways which are involved in seizure activity, and that contributes to epilepsy in CTNNB1 syndrome. As parents, okay, we found that our child is having a seizure, or how should we deal with that? So for this, I spoke to a very premium, like very renowned epileptologist in Israel. His name is Shmulik. I need to thank him. And he told me what basically as parents or as caregivers we need to do. Number one thing, you need to try to understand what child is feeling, because most of the cases they are nonverbal, they are not able to tell you, but you need to try to understand what exactly they're feeling, how they are going through it, and what happened. Next, find out how their behavior changed, their actions changed before and after the seizure. What happened? And you should be like, you need to learn. It's hard, but you need to understand for your child. And we have been trying all this for our kids. Maintain a seizure diary. Record everything. What happened during the seizure? What was the onset? How long it was? How frequent it is? This will help in something for the doctors. It will help in something I'm going to tell further. And as patients, they have seizure in sleep, you wake them up. You wake up the child as soon as you feel that your child is having a seizure. Wake them up. That's the first step you need to do. And then record everything and just try to understand it. For doctors, for neurologists, for epileptologists, there is a term called convulsive seizure frequency. Convulsive, the word literally means uncontrolled muscle contractions. Convulsive seizure include hemiclonic, focal, tonic-clonic, and etc. type of seizures, many different types. Convulsive seizure frequency is basically it's calculated monthly, and it's calculated based on the seizure diary. That's why I emphasized on maintaining a seizure diary. This particular measurement, it will tell how severe the seizure is. It is directly proportional to the seizure severity. How to calculate it? For a 28-day CSF, you divide the number of convulsive seizures, which are these, reported in 28 days, and just divide them by non-missing diary days, and multiply the product by 28, and you get a value. And this value you can directly relate to the severity of the seizures. In conclusion, I would like to say that epilepsy as a symptom is very underrated, and it is very, very important to diagnose and raise awareness about epilepsy, because every epileptic seizure to your child can be leading to a damaged risk of brain. It's very also important to understand the mechanism, because not only to develop a drug, but also find a correlation between neurodevelopmental pathways which are impacted, and ultimately it's a neurological disorder. And it's important to note that every CTNNB1 patient doesn't have a seizure. You need to get it screened. That's what the main point of the topic is. And we need to bridge the gap between CTNNB1 syndrome and epilepsy. Finally, I would like to say, you need to get a seizure. Take your child, get an EEG, and get screened for seizures. It's very important. I request all the parents here to please, please, please take your child through an EEG. Thank you.